Sarah's hands trembled as she held her phone, contemplating whether to call her doctor for the third time that week. The persistent headache she'd been experiencing for 2 days had convinced her that something was seriously wrong. Despite her physician's reassurance during her last visit that her symptoms were likely stress-related, Sarah couldn't shake the overwhelming fear that she was suffering from a brain tumor or some other life-threatening condition. This was the reality of living with illness anxiety disorder, a condition that had gradually consumed her thoughts and dominated her daily existence. Illness anxiety disorder, formerly known as hypochondriasis, is a mental health condition characterized by excessive worry about having or developing a serious illness. Unlike other anxiety disorders that focus on external threats, this particular condition turns the body itself into a source of constant fear and preoccupation. Individuals with illness anxiety disorder often misinterpret normal bodily sensations as signs of severe disease, leading to a cycle of medical consultations, tests, and temporary relief that quickly gives way to new concerns. The development of Sarah's illness anxiety disorder began subtly during her college years. Initially, she was simply health conscious, paying attention to her body and maintaining regular checkups. However, after a close friend was diagnosed with cancer at age 22, Sarah's awareness of her own mortality intensified dramatically. Every minor symptom became a potential harbinger of doom. A slight cough suggested lung cancer, stomach discomfort indicated possible tumors, and skin changes pointed to melanoma. What started as reasonable health awareness transformed into an all-consuming obsession with disease and death. The psychological mechanisms underlying illness anxiety disorder are complex and multifaceted. Research suggests that individuals with this condition often have heightened awareness of bodily sensations, known as somatic amplification. They tend to interpret ambiguous physical symptoms in catastrophic ways, immediately jumping to worst-case scenarios. This cognitive bias, combined with excessive checking behaviors and constant self-monitoring, creates a vicious cycle where anxiety actually produces physical symptoms, which are then interpreted as evidence of serious illness. Sarah's daily routine became increasingly structured around her health concerns. She would spend hours each morning conducting self-examinations, checking for lumps, moles, or any changes in her body. Internet searches became compulsive activities as she frantically researched symptoms and diseases, often finding information that only amplified her fears. Medical websites and forums became her primary sources of information, despite knowing that this behavior typically increased rather than decreased her anxiety levels. The impact of illness anxiety disorder extends far beyond the individual sufferer. Sarah's relationships began to strain under the weight of her constant need for reassurance. Friends and family members grew frustrated with her repeated requests for confirmation that her symptoms weren't serious. Her romantic relationship suffered as her partner struggled to understand how someone could be so convinced of having various illnesses despite repeated medical clearances. The disorder had transformed her from a vibrant, outgoing person into someone who was constantly preoccupied with health concerns. Professional life also suffered significantly. Sarah's productivity at work declined as she found herself unable to concentrate on tasks, constantly distracted by physical sensations and worried thoughts about her health. She frequently called in sick, not because she was actually ill, but because her anxiety about potential illness had become so overwhelming that she couldn't function normally. Colleagues began to notice her frequent absences and distracted behavior, leading to concerns about her job performance and security. The diagnostic process for illness anxiety disorder can be challenging because individuals with this condition often have legitimate medical concerns that need to be addressed. Healthcare providers must carefully balance the need to rule out actual medical conditions while avoiding unnecessary tests and procedures that might reinforce the patient's illness beliefs. Sarah's journey through the healthcare system involved multiple specialists, countless tests, and significant financial costs, all while her underlying anxiety disorder remained unaddressed. A treatment for illness anxiety disorder typically involves a combination of cognitive behavioral therapy and, in some cases, medication. Cognitive behavioral therapy helps individuals identify and challenge the catastrophic thoughts that fuel their health anxiety. Patients learned to recognize the difference between normal bodily sensations and genuine symptoms requiring medical attention. Exposure therapy techniques may be used to gradually reduce checking behaviors and decrease reliance on medical reassurance. Sarah's recovery journey began when she finally sought help from a mental health professional who specialized in anxiety disorders. Through therapy, she learned to identify the triggers that activated her illness anxiety and developed coping strategies to manage her symptoms. Mindfulness techniques helped her become more aware of her thoughts without being overwhelmed by them. She practiced accepting uncertainty about her health rather than seeking constant reassurance through medical consultations or internet searches. The process of recovery was not linear or easy. Sarah experienced setbacks when new symptoms appeared or when she encountered health-related information that triggered her anxiety. However, with consistent therapeutic support and the gradual implementation of healthy coping mechanisms, she began to reclaim her life from the grip of illness anxiety disorder. She learned to trust her body's natural healing processes and developed a more balanced relationship with her health and mortality. Today, Sarah continues to manage her illness anxiety disorder through ongoing therapy and self-care practices. She has learned that complete elimination of health-related anxiety is neither realistic nor necessary. Instead, she focuses on maintaining a healthy level of concern about her well-being while preventing anxiety from controlling her life. Her relationships have improved as she relies less on others for reassurance and more on her own coping skills and professional support. The journey through illness anxiety disorder teaches important lessons about the relationship between mind and body, the nature of anxiety, and the importance of seeking appropriate professional help. While the condition can be debilitating, with proper treatment and support, individuals can learn to manage their symptoms and live fulfilling lives despite their health concerns.